It just says that we won't like share it with
Yeah,
people.
this I just call it.
What does that mean?
Yeah, it's
What is this,
Yeah.
ma'am, and what is that?
bullshit.
We say famously in the state of Texas.
Oh.
That's all.
That's funny.
That, you know, that is it's a slang. It's American sign with the slang American sign that. Oh no, you're full of.
Oh.
Okay, come on, guys, come on, guys.
You know a lot of languages.
Oh, I learned English. English is not my primary language.
Oh, wow.
Yeah, and yo puedo hablar español con los muchachos aquí, latinos. Yo puedo hablar español porque en Texas necesita aprender español.
Yeah.
Pero yo soy de Grecia, guys. I'm from Greece. My primary language is Greek and Korean. Why you tell me I can learn English quickly and Spanish quickly? In Greece, I have to learn Latin. That's why I like science, because all these words are in Latin, and it was easier for me to know this. And I excelled in science because of the Latin roots.
Mm-hmm.
And I had taken Latin forever. So it was easy for me to learn English, easy for me to learn Spanish, because of the Latin-based language that I grew up with.
That's cool.
So English I acquired, Spanish I acquired. I would love to speak Mandarin and Cantonese. I would love to speak it. That was great. That would be great. But it's not that hard. Yeah, well.
Mm.
Dr. King, you never spoken Korean.
안녕하세요. 안녕하십니까. So here we got what's so what's so special about this? What first of all, there's I want you to look at this bone here, or this vertebrae bone, okay? Now, which vertebrae bone do you think this is? Is this a cervical, is this a thoracic, or is this a lumbar? Who says lumbar? Raise your hand. You guys you just got it wrong.
I'm just guessing.
Look, I told you in lab last week.
Oh.
Remember, the thoracic, look at the spinous process. Look at the spinous process. Look, if I put my arm like this on the spinous process, that's always going to be thoracic. If the spinous process always goes down like this, it's a thoracic. Now, this is lumbar, guys. Look, girls, whoever picked up lumbar, look, lumbar is like this, like a hatchet. That's what it looks like. And the body is thick just like this, but the spinous process, they come out like this, like a hatchet. It looks like a hatchet. All right? So if it looks like a hatchet, you know it's what? Lumbar. And if it goes pointing downward, it's what? Thoracic. Now, the question for this pit is this. What the heck is this facet here? What is that? It is called the costal demifacet. And what does the word costal mean?
Rib. Cartilage.
Yeah, cartilage or chondro. So what's gonna connect to this thoracic? What's actually connected to the vertebra thoracic?
Rib.
Other than what? The rib cage.
Oh, yeah.
Your rib cage. Remember, the tubercle of the rib cage is right there. You remember if there's, I'll go over the rib cage. Don't worry. So the rib cage, the rib bone is going to sit right there, and it's going to go around and it's going to hit the what? The costal cartilage of the sternum, right? So this is it. This is thoracic. So if you see do you have this in your lumbar?
No.
Do you see this in your cervical?
No.
You only see this in thoracic. And look at the process here, spinous process. Yes.
So where does the head of the rib cut?
The head of the rib?
That's the spine.
Yeah.
Oh.
And this is the front or the back? Posterior, anterior?
Back.
Posterior. The anterior is going to hit the sternal cartilage.
Yeah.
Okay, so here, look at this guy, right here. Now, this is what I call, if this is the body, and you have these two little structures that come down like this, what do you think these, they look like what? Little legs, right? They look like little legs? Pedicle. Elan, little legs. Okay, pedicle. Okay, little leg, pedicle. And this is the what? Spinal process, and you got the transverse process.
Wow.
Got it? Good? You guys liking this PowerPoint? And going on
Yes,
A
please.
lot. Very helpful.
Huh?
Very helpful.
Yeah. The both of them. You got the easy view. Oh, there's two, guys, I have two PDF. One's the easy view, that you have all the bone structure in there, and you can name it just by looking at it. Then you got one by one by one by one, that's real long, okay? So you got two of them. The long ones you can practice on your own to get ready for practical, then the other one you could have here, and you could identify, oh yeah, this makes sense, this makes sense. So you know exactly where it's at, all right? And that's the reason I set it up that way.
Also that one.
Pedicle. Now here's what is this bone? Sacrum. Is this one bone or is this is fused? What is the fancy word in biology that we use when it's fused? You got 5 fused bones here. You got 1, 2, 3, 4, 5. And now what's the fancy word for fused in biology for this? Composite. Yeah, composite. But we could say it's a sacrum bone, and the sacrum has 1 to 5 fused bone into 1, 5 to 1. And here we got this middle line. Is this is this the back of it or in front of it? Back. Because you got these orifices here.
Wow.
Now look at this here, middle line here. And what's this here? The coccyx, right? The coccyx 3 to 5 fused bone. So here, this is called what? Right in the middle, median sacral crest. This is the middle, this is the sacrum, and there's a little crest because it's protruding out. And now here, look at this. The lines are horizontal, but these are called transverse lines because this transverse line shows you what? 1, 2, 3, 4, 5. Okay, 5 fused bone into 1. Transverse line.
I only see 4. Wait, what was this one?
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Oh, okay.
1, 2, 3, 4, 5. Right there, guys.
I'll be back.
Okay. Okay, here's the rib cage. You had a question on the rib cage, right? So here it is, guys. Remember the demifacet, right? On the thoracic demifacet. Now here, look at this. This is where the demifacet sits. And look, guys, this is how you know the difference between the posterior and the anterior by looking at what is this called. This, you have to know this, guys. This is the only way you can tell if this is anterior or posterior, okay? Articular turbicle. That articular turbicle looks like a little protrusion. I have a rib cage there somewhere. Here. Here you go. So you got this bone here. They're gonna say, is this left or right? Yeah, I mean, I'll make it really hard. Left or right? And they can say, which is which end? Which is the one that's considered the demifacet of the thoracic? Well, you're gonna look at it, and you can say, oh, look at that. There's a little protrusion here. That little protrusion is called what? Articular what?
Tubercle.
Turbicle.
Turbicle.
That's what you can see. All right, right here. Articular turbicle, right here, guys. Okay, everybody see this? This side is going to be where? Hitting the demifacet thoracic. So right here. Yes? That's what you're going to, you see this? That's what that is.
So that posterior?
So we
Huh?
see it and then what? Now that we found it, the bump, and then what do we do?
You name it.
But you said it determines whether or not it's anterior or posterior.
Yeah.
Or...
That's a very important question because this side hits what? The thoracic bone, the thoracic vertebra. Because this side is going to hit what? The sternal side, the sternal cartilage. And this side is going to hit the thoracic. So that's the question. That's a conundrum of identifying these rib cages, figure out, is this the sternal side or is this the sternal side? Or is this the thoracic side or is that the thoracic side?
So the articular tubercle is on the thoracic side?
Thoracic side in the back. Yeah.
Okay.
Yeah. Now, just talking about the rib cage, just talking about rib cage now, what is true rib? What does that mean?
They connect. They, like, totally touch?
Thoracic.
Yeah.
So, and what are the numbers to true thoracic?
1 to 7.
Excellent. Now, what is the false ribs.
8
The 8 to 12, but 11.
8 to
11.
10.
Oh, yeah.
8 to 10. The floating ribs are
11, 12.
11 to 12. Write that down, guys. True ribs are 1 through 7. And then the false rib that hooks to the cartilage of the sternum is 8 to 10. Then the floating ribs are 11 and 12. Make sure you get that down so you don't forget. That's something you should know. Yes, Naftali.
Do you have a preference for how we write it on the practical, or do you want it as the vertebrosternal or vertebrocondylar?
You could write it whatever. As long as I understand it, I know exactly what you mean.
Okay.
That's me, guys. I don't know about yours.
Yeah, I wish.
If I could understand, that's why I make my students very comfortable with me and comfortable with the exam. They don't have anxiety. They just go and take it. Whatever they know, they get it. Even if they misspell it, I have an idea what they're trying to spell out.
Wow.
So this is the term, but you should know how to spell it out. This is important. I'm not saying it's not important, but it is important. But for the sake of this class and making someone do better and not stressed out, because the more stress you have, the worse you do. I mean, there's a psychological component to this, you know? That's why everybody go take a test and they freak out and they go blank. They're not at ease. You know, they're not able to relax and take the dang test and make a successful grade.
It's also fun when everything you study, none of it ends up being on the exam.
And I bet you guys crammed the day before.
No,
No,
we study.
we
2
meet
weeks, 3
almost-
weeks,
yeah.
every day.
Really?
Yeah.
How many
every
hours?
other day, like.
At least, every time we meet, it's at least 4 hours.
That's why.
No, we take breaks.
Yeah.
We
Oh,
don't,
okay.
yeah, we don't meet at school, we go to our house.
You study 2 hours, you need more than an hour break.
Yeah, we take breaks.
Yeah,
We
you
go get
need
dinner.
More than an hour break. You know what the best tool to help you retain memory? Guess what it is, guys? The best way to retain, how do you retain memory, Josh?
I don't.
Oh, sorry.
He's honest.
Andrew, how do you retain memory?
I don't. I cram like 2 days before the exam.
Oh my God, the opposite of what I'm trying to teach you. Clarissa?
I normally just go over the book, turn it.
She's like me. I just read the book and I'm done.
Probably repetition.
Yeah, repetition.
You got most of you guys are repetition. Now, if you study more than 2 hours, you're doing a disservice to yourself. Only study 1 to 2 hours. Take a more than an hour break, then go back at it again. Whatever time permits, work, whatnot, whatever you got to do, go do it. Then go back to where you left off and go at it again. That's the secret. Okay. So don't study 3, 4, 5 overnighter. Don't do that. Don't cram.
Mm.
Some people do it for so long they get used to it, you know. So this is what I was getting at here about the right here, guys. Look, R, O, S, and L. There's what is this hole? Lacerum. And what is that hole? And then this?
Oval.
Spinosa. Yeah. So these are the inside. No, here's another thing that they didn't teach you. This is called the frontal fossa. Remember I told you fossa means what?
Deep cavity.
Yeah. So there's a deep cavity here. What is this called?
Frontal
Why is this called
fossa.
frontal fossa? Because the frontal bone. What is this portion called?
Parietal.
Median.
Medial.
Fossa. Then what is this whole the biggest, deepest basin of your skull vault? And what is this whole thing called?
Occipital. Posterior.
Posterior fossa.
Fossa.
Yeah. Fossa is the big
Deep cavity.
hole. Yeah. So this fossa is the posterior because we're looking at the back. And it's the biggest basin or biggest fossa because this is where all your cerebellum and all that good stuff sits. And this is where, what is this hole called?
Magnum foramen, I know that one.
Good. And what goes through it?
I don't know.
Spinal cord, the lower half of the brainstem, the medulla oblongata, and all that good stuff.
Mm.
So right here, they ask you what is that called, and that's it. That's not. Is that optic canal? Is that optic canal? Is that optic canal?
Doesn't look like it.
Huh?
Which one, sir?
Optical canal. Where's optical canal?
The top, yeah.
This is screwed up. I made a mistake.
Oh
Boo-boo.
my gosh.
You know, Mr. Kim, hey, I'm human. I'm allowed to make mistakes. Okay? Don't beat me up, all right? So that thing should have been like this.
Yeah.
Like that. That should be optic canal. You remember, it looked like two little eyes sticking at you, the optic canal. This is where I was telling you about. Do you guys know the Latin root for crossing? How do you say crossing in Spanish? Cruces, right? And Latin is chiasma. So this is where the chiasma of the optic nerve occurs, right there. It goes backward. It crosses.
And
Yeah.
between the optic
Yeah.
canal right there is the hypophyseal.
And if I tell you draw the nerve path, you guys gonna just
Is that
cry.
something we have to do? Like eventually?
I think the second LUMP you're gonna have to.
Oh.
So you don't have.
So not me.
I do.
But you know, I have a little secret how to name each one and how the nerve path goes through. There's a node that you have to go through step by step to get to the visual cortex. I have a little step. I did a nice little diagram so you can see it. Actually visualize it. And you're able to just, if I drew the diagram, you could able to just fill it in real quick. Here, I said this already. This is what? Exterior meatus. That's where the eardrum. Now here's the funny thing. We talked about the cranial bone. We talked about the facial bone. We have 8 cranial bones. We have 14 facial bones. Now, there's some other bones that we didn't talk about that don't, how can I say, actually interact with other bones. And what is that single bone?
Is it hyoid?
Hyoid bone. You guys remember hyoid bone? Yeah, the one that looks like a horseshoe. And that is what? Your vocal box, your voice box, your larynx. If I asked you what is that in your test, you say it's the bone that sits right there with your vocal box or your larynx. Okay, your larynx bone. And it sits right there. And if that is, when I'm doing an autopsy and I open it up and I look at the hyoid bone and it's fractured, what does that indicate? Strangulation, or, you know what I mean? Oh, here it is. I've written down here. Look, external acoustic meatus. So, exterior acoustic meatus. I just wrote it exterior meatus, but it's supposed to be exterior acoustic meatus. Right here. Right here. Right here. Acoustic meatus. Okay? It's a hearing. And just talking about the meatus, exterior acoustic meatus. We talked about hyoid. What's the other one? There's 6 of them. What are those 6 bones that I talked about? The other. We talked about the 8 cranial. We talked about 14 facial. We talked about 1 hyoid. There's 6 more bones that we're missing.
Cranial.
That makes up 29. What is it?
Oh, huh?
What is it? 6 bones that we haven't talked about.
Alveolar bone.
No. Alveolar is the process right here. This is the maxilloalveolar, mandibular alveolar.
Right?
So what 6 bones that we didn't talk about? Ossicle for the hearing. You got the anvil, hammer, and the stapes. Those 3. You got 3 here and 3 here. So that's 6.
Oh.
So those are the anvil, the hammer, and the malleus, and then the stapes. The 3, just 3 ossicle bones. Ossicle bones. There's 6. There's 2 of 3 ossicle bones. So the total 6. Okay. So you got 2 pairs of ossicle bones. There's 3 on each side. So you got 6. Okay. And this is what? The stapes. The stapes is the smallest bone in your body. Write that down. Stapes, right there. Stapes is the smallest bone of your body.
What is a stapes?
Stape is the one that is from your eardrum. It moves the set of bones here, the malleus. The stape is the one that looks like a pitchfork that's stuck to the nerve on your cochlea.
This is on the practical?
Yeah.
I've never heard of this.
Okay. Let me.
I'm sorry.
Okay. Hold on. Make it easier.
Do y'all know what this is?
Yeah.
There's no ear section in the book.
Well, then that's why she didn't.
Here,
teach
look
it.
at, look.
I am assuming.
Look. Is that, right there, perfect, look at that, guys. Look, right here, you got the eardrum, right? You got, this portion is called the malleus, then right in the middle is called the incus. Then right here is called stapes or stirrup, because it looked like a pitchfork, it looked like a stirrup. Okay, right here. And that hooks to the labyrinth of the vestibule of the cochlea, right here. Look at this, stapes. Is that better? So you got malleus, incus, and stapes. Those are the three ossicle bones.
Does everyone in A and P one take the same practical, or?
Yeah, everybody takes it. Yeah, so I already.
Yeah, our teacher never mentioned anything about this.
So I guess it's funny, like, all of you professors see each other's class averages, or what?
You can, yeah. But, you know, everybody teaches differently, and I teach differently. You guys know how I teach. Yeah, so
Efficiently.
you can tell the girls, how do you guys like my class?
It's really good, Dr. Dan. 5 stars.
See? So they like it. Because they like it because I guess I'm animated, and I come here and I talk about this stuff, and I make you laugh, I make you feel comfortable. I want to build that trust, and I do the collaboration with you. And we talk about all sorts of stuff in here. I mean, we talk about everything.
I like the stories about the ICU.
Yeah, see, I worked in trauma surgical ICU for about 25 years, so I give you a bunch of stories, along with these stories. I could go over every body part, and I could tell you trauma about every single body part that I've been through.
Wow.
So now you guys know what that is, right? So that's the smallest bone. Now going back with, since we know what is the smallest bone, so what is the largest bone? What is the largest bone? So you know what the smallest bone is, the stapes, right? In the ossicles of the ear, the one that hooks up to the cochlea, the tubercle of the cochlea, the vestibule of the cochlea. So what is the largest bone? Write that down. What is the largest bone? Femur. The longest and the strongest bone, the femur. And then the next one is the humerus. Yeah. So femur, the leg bone. The leg thigh bone, that's the femur. So, ¿cómo se llama? Sí.
My name?
Sí.
Jose.
Jose. What is the biggest bone in your body?
The femur.
Excellent. The smallest?
I forgot the name of it. Sorry.
Stapes. Yeah, stapes. Did you see, were you here to see the picture
Which one?
of the ear, middle ear, right here?
Yes.
Oh, you did? Okay, here, this is the eardrum, right? Right the eardrum, you got the malleus, incus, and the stapes. And the stapes is the one that hooks to the vestibule of the cochlea. And that is the smallest bone of your body. And the biggest bone is just like what you said, femur. And then the next biggest is
Humerus?
humerus, ándale. Muy bien. Are you from Mexico?
Yes.
Okay, muy bien. ¿Qué parte de México?
San Luis.
San Luis. Oh, yo tengo muchos amigos de San Luis, what to see. Mucho.
What's your first name, Mr. Kemp? Mr.
Eric.
Kemp? Eric? Okay. I'm stalking you on Rate My Professor.
I don't care if you call me Eric, it doesn't matter. I mean, I have the guys just call me whatever.
Are you on
remember,
Rate My Professor?
Remember, I'm your friend. I'm not your enemy. I'm not.
Why?
Just treat me like if I'm your classmate in the classroom.
Well, you're
because I'm
not-
gonna make this feel comfortable.
Is that why you're not on Rate My Professor?
I don't put nothing on there.
No, it's ERICKIM.
Yeah. Yeah.
Huh. You know,
No, the
here.
best professors are never on that website.
Interesting.
I keep myself low profile.
Yeah, you do.
Low profile.
It's
I'm
an
invisible. I'm a ghost.
insider secret, I guess.
It is. I keep it that way. Now look at this, guys. Look at this. You guys have to know this. There's right here, guys. If you look at the skull here, and you see that little slit in the eye cavity. You see that in the orbital eye cavity? Look at it. Look, Chuck. Look. See that little slit in the side there? Right there. Right here. You see that slip? That's called superior orbital fissure. And you wonder, why the heck do you have that big hole right in the back of your eye?
That happen to drill the eyes.
The cranial nerve to see. That's where your cranial nerve lays. Your optic nerve. So make sure you guys remember. Remember that's called what? Right, highlight this. When you get it, highlight it. You're gonna highlight, you're gonna say superior orbital fissure. Make sure you highlight that. I want you to write it and highlight it. Superior orbital fissure. And what leaves there? You got the cranial nerve, the optic nerve that goes through there. Right? Make sure you get that. So here, I have put this up there just you guys take a pic of it if you want. I don't know. It's something for you guys to see here. It's live free to see, no insult at all. And it's a mnemonic. And what that means is what? You got the lacrimal, frontal, trochlear. You don't have to know this till, I guess, the next test. You guys have to know some of these nerve paths. And I always make mnemonics for everything. Remember the one I showed you about the epidermis and all that good stuff? Yeah. So here's this one in here. This is actually inferior nasal conchae. You got two conchae, or actually three conchae. You got superior conchae, you got middle conchae, and you got inferior conchae. And these are from different bones. In this particular area, the one that looks like a little hook going down, that is called inferior conchae. Conchae is spelled, you could put concha, or you could say conchae with an E. Yes.
So I've noticed a lot of the words you're saying, we have had it told to us differently. So are you saying it the correct way, or are you saying it your own way? I'm not saying that to be rude, like genuinely.
I say it like the way
That it's supposed to
people
be
that
said.
speak Latin, because
Like-
I grew up speaking Latin.
So
I say
it's
it-
not Fisher, it's not Concha, like you say all of these things differently.
Yeah,
It's not
because-
fossa.
Yeah, that's the way in Latin language, that's how you're supposed to say it.
Interesting.
Yeah.
Here,
So-
the whole time I thought I was right.
I mean, my philosophy is that if I understand what you're trying to say,
Okay,
so it's just communication process.
right.
But if you want to be, I guess, to the T, then you want to say it properly.
Well, she has difficulty pronouncing some of the like really hard anatomy English words, and so I tell her like, oh, it's concha, and now I've been telling her wrong the whole time.
Yeah, it's okay. Most people that speak Spanish, de español es el primer idioma, ¿verdad?
Sí, yo soy de Venezuela.
Sí, es mejor porque de palabra todo en español es la misma de latino. Latino, la misma. Okay, so here you got the inferior nasal concha. Now the one on top is what?
Superior.
Superior nasal concha, and that's the what bone is superior?
The perpendicular plate.
Ethmoid. And then ethmoid, you got that cruciform plate that makes the turbinate. You remember the cruciform plate that look like little slits like this? Like little slits? Those are the turbinate. Those are the cruciform plates of the ethmoid. But we'll go over that. Don't worry. We're gonna go over it.
Brave.
Oh, here's a good one. This is a very good one. This is a very good one. This is not just, here, this is correct in a way. I said bone. Did I say bone or just said process? Here, look. Did it say bone or did it say process?
Oh.
Bone, you got two different regions of the palatine. Which is the bone and which is the process?
On the top is the process.
Palatine process,
Oh, wow.
palatine bone. Two separate bones, guys. This bone right here, I'm sorry, not bone. This process is what? Maxilla. And talking about, if I asked you, what is in the incisive fossa?
It's that little
Yeah,
hole
it's
right
right
there.
That little hole right there. That is in the maxilla of the palatine process.
Okay.
Make sure you guys write it down, guys. Guys, look at me. Palatine process equal maxilla. where the incisive fossa is located at. Palatine bone is separate from the maxilla, it's not the maxilla.
Yeah, well, I want to question, talk about the article, because there are several bones to make the whole. I cannot imagine the palatine part of it, like that, very simple.
Yeah, but they're fused together with this fibrocartilage material. It makes it very hard because it'll take an act of trauma to separate it. Yeah.
Would you mind possibly going back to the last slide? You were mentioning from the superior nasal concha, I'm gonna say it wrong. And you put ethmoid.
The growth didn't come.
Yeah, one said it can't be 15 minutes.
Okay.
So I need to go to a corner.
Okay. Sounds good. Bye. You have everything.
Yeah.
Yeah. Inferior concha, superior concha, right here. Superior concha.
You said something about the ethmoid though, that's where I got
Oh, I'm sorry.
confused. No, that's okay,
Yeah.
thank you.
This superior concha,
Mhm.
and there's this another bone that comes down here meeting the vomer. Right? This is the vomer, right? Vomer, and then you got another one that comes down here. What is that bone called? Perpendicular plate.
Oh god.
Right near the perpendicular plate, you have the cribriform plate.
Oh god.
Then right there, cribriform plate, you have these little protrusion out here. It's called what? Superior concha. Okay? So, and usually this cribriform plate, the turbinate, they're full of mucus, so when you're breathing in, the particles get trapped in mucus and you get sinus infection, you want to blow your nose out.
That's
So,
the cribiform?
yeah, the cribriform plate or turbinates. And these are conchae, you got the perpendicular plate of the ethmoid, and then you got the vomer. Yeah. You guys think the vomer, look guys, you guys gonna think this vomer is nice little tiny protrusion bone. No, don't think that way. It's a big bone that fans out like this inside. Yeah.
We've been saying it
How we
Vomer or Vomer this whole time.
How we remember Vomer, because we made a joke about it in class, was that
Okay, guys,
Voldemort
you guys went over
has
this.
like that
Wait,
weird
what's
nose
the
thing,
whole,
so
like,
Vomer, Voldemort.
No, wait, no,
So that's how we've been
the
remembering
next
it in
one.
class.
The next one?
Her.
Okay. Okay, guys, here
Wait, what's
again.
the-
Okay, guys, what is that hole called?
Incisive.
Fossa. And what is this thing called? Palatine process. This?
That's the palatine bone.
Bone.
Palatine bone. And this area, what bone is this?
Maxilla.
Excellent.
This is fun! I'm learning.
The hole is called fossa?
Oh my
Fossa.
gosh.
Fossa?
Fossa.
Fossa.
Anything
Fossa.
with bone,
Amanda's
yeah.
here.
Oh, just fossa?
Yeah.
Yeah, it's like a big, deep hole.
I guess.
So
it's
process of the front, bone in the back.
Yeah. Okay, here it goes. Look at this. What bone are we looking at now? Yes, no. study.
Scapula.
question.
Was it incisive fossa or just fossa?
Incisive. Incisive fossa. And they call it incisive fossa because this is where you bite, and then the fossa means there's a big concavity, or it's like a big trench in there, in that area.
Okay.
Yeah. So, going back with the what bone is this? Scapular, right? Shoulder blade,
Scapular.
yeah, scapular. Now, look at this. I'm gonna ask you a question. Is this the right or left scapula? Right. Why is it right? Yeah, this is where the lateral side is. So if this is the lateral side, and this is the mid-sagittal, and this is the lateral, obviously, how do you know if this is the front or back side? That's the question. The spinous process here. When you put your shoulder blade and you feel that bone, that's what you're touching. Yeah, that's what you're touching. That's how you know that is the posterior aspect of the shoulder blade or the scapula. But yes.
That's called a spinous process, the part you just touched.
Yeah,
And that
that
shows.
big bone right here, all this.
And that shows that it's posterior.
Yeah, that's posterior. And then here, this is where your glenoid socket is, where the humerus sits right there. So did you know this is the lateral side, and this is the medial side, right, Josh? Okay, so what is this notch at the very top called? Remember, this is the very top. So what did we say first thing? The top is what?
Supra.
Supra scapular, because you're talking about scapula. Suprascapular notch. So write that down, guys. Suprascapular Notch. That's an excellent book. Yeah, I have several books. The one that's by a doctor, he drew the pictures. I have some right here with me, and I'm gonna show that at the very last. But this one I want to go over so to show you exactly what you, and I want you to go home and do this on your own. Get ready for that. Practice. Do this like if you're don't look at the answer. That's why I put it on the bottom real small, so you can just look at the picture and say, oh yeah, that's a suprascapular notch. And look at it. If you need help, you just look down and say, oh yeah, that's what I'm looking at. I only screwed up one picture. I only screwed up one. What is that one picture I screwed up at?
The canal goes all the way
Optic.
up.
Optic canal. That where the chiasma is.
What's a chiasma?
Chiasma means crossing. La cruz es en español.
Okay.
Yeah. Okay, what are we looking at here?
Patella.
Yeah, patella.
Mm.
That's the knee bone, right? Now the knee bone on the inside of this knee bone, not the outside. You're looking at the posterior aspect of it. We got these little facets here. We got little facets, and the question is, how do you know from what is what facet? Medial conduct, because how can you tell if it's lateral and this is medial? How can you tell? How can you tell? Which structure the femur articulate? Because the femur has to hit it. Articulate with the surface of the patella, because they're both sides. There's a lateral side of the femur, and then you got the medial aspect. How can you tell? Yeah. How can you tell? If you look at the lab book, even in the lab book, if you put a line through it, one side is gonna deviate just a slightly like this, like 10 degrees.
Oh.
That is the medial side.
Oh, I see.
Yeah, that is the medial side. So if you look at it, that's the medial side. It's like a 10-degree deviation, and that's the medial side. And you can see, look at this, guys. Look at this. Even this. Look at this.
So,
Yeah,
what side of the body would that one be on?
on the middle side.
Well, no, yeah, but like.
If it's middle, this has to be, and this is the back.
So
It
this
has
is
to
the
be the
right.
right. This
Okay.
has to be the right knee. Because it's like this, and this is the middle side, so it has to be like this. You're looking at this way on your patella. So this has to be the right knee.
On the practical, will it be asking you left, right?
Sometimes, I'm just telling you. Make sure they're gonna ask you like, is this left or is this right? Is this anterior or is this posterior? You're gonna have to know that.
Are we gonna go over
The clavicle?
Yeah.
Yeah, the clavicle is easy. Remember, the clavicle is the easiest bone to break. I forgot to mention to you. Clavicle is the easiest bone to break. It's not gonna be on your practical. But just for FY, for future reference, and you go and work in a hospital and whatnot, the clavicle bone is the most easiest to break. Smallest bone stay. The largest bone, the next. Okay? Got it? Crystal clear? Okay, here we go. Now we get to the ox coxa, or the pelvic girdle. So this is what? Sacrum, and then we got the hip bone, and right here in the middle, this black indication is called pubic symphysis, right? This pubic symphysis is like a fused cartilage that holds its place together. Right here, there's this big old arch here. What is that arch called? Pubic arch. If you know that the pubic symphysis together create the pubic arch. And so we go over it step by step by step, and there's 92. You can see if there's a 92. When you go over it, it's going to be very structural. And when you go take your practical, you're going to feel so confident in taking this practical. You're going to say, oh, I'm going to get this perfect. It's going to be easy. Well, at least you're going to get at least. If you study this, just guaranteed B, at least. Then the rest of the stuff, you just what I told you, or maybe better. Who knows? Okay, what is this, guys? This is a good bone. What is that?
Tibihima, Huber,
Is this the humerus? Excellent.
something like that.
It don't have the trochanter. The greater and lesser trochanter. On the hip bone is like this, and it gets huge neck. There's no huge neck here. That's how you can tell the difference. Then plus, you got this, yeah, the condyle, the trochlear condyle other. So, oh, I forgot to tell you what's right here.
What kind of joint is that?
Lateral epicondyle.
Joint, is that what you
Yeah.
said? Would that
So
be the hinge?
what does the lateral mean? Look at the socket,
Side.
guys. Where's the socket pointing to? It's pointing that way. So if it's pointing that way, that's the medial side. Anything with a socket that points that way is always to the media. Anything that's on the outside, you know it's going to be lateral. All right. So anything that with a socket, a ball and socket, the ball and socket pointing that way is always facing the media. And anything afterward is obviously the lateral. And then when we go over the tibia and fibula, remind me about the malleolus, or your ankle, the inside ankle and the outside ankle. Just like my ankle, if you look at the ankle here, and you see the middle on the media side, you're standing on your weight-bearing bone called the tibia. That's your weight-bearing bone, the tibia. And on the outside of the ankle is called the tibial malleolus. That makes your inside media ankle. Then the lateral is the fibula. That your ankle on the outside is actually a fibular malleolus. The malleolus is the ankle bone. So let's look at the next bone here. Oh, this is when you're looking at this carpals here on the feet, guys, look at this. The tibial sits where? Remember I told you tibial is your weight-bearing bone, right? If the tibial sits, where did it sit? What is this bone called? Talus. Excellent. And right next to the talus is what?
Navicular.
Navicular. Easy. Navicular. Okay, so talus, navicular, and this big, huge heel bone called
Calcaneus.
calcaneus. Excellent.
I learned
Excellent.
something.
Yeah. When you guys go over this, you guys are gonna love it. Oh, you're gonna have to know this. You're not gonna see this. Oh, what bone is this?
Femur.
Now, if it's pointing inward, this is what? What bone is this? Is it left or right?
Left.
Yes, very good. And this is called adductor tubercle because why they call it adductor? What do when you put your leg out like this and you go into the medial line?
Wow.
It's adductor. If you go out, it's called what? Abductor. If you do this, what is this? What is this? Circumduction.
Because it's a cone.
What if you do this with your ulna and remember, this is what I told my class, okay? Look, radial ulna. This, what, if you go with your hands like this and you do this, what is that? Supine or supination. When you're supinated, your ulna and radial are parallel. What do you do when you do this? You pronate or pronation. You put it face down. If they say pronate, you lay down with your face down. If you supine, you're facing the ceiling looking up. Same thing. So ulna, radial and ulna, they're parallel. If you pronate, what are you doing? You're crossing the radial over the ulna. That's pronate. Just remember that. That's supination and pronation.
The knob side is the lateral. What is that called? Not a knob, but the ball.
The socket, yeah, the ball socket.
That's
Yeah.
the lateral?
That's always pointing the medial, and this is the lateral side.
Medial. Okay.
Yeah. And that's the reason why that thing is called adductor, because you're going toward the middle. If you're going away from the middle, it's called abductor, yeah. And if you make a bunch of circles, you're making circumduction. Oh, here's the one here. Look at this word here. Iliac fossa. What is fossa? A big indentation cave, right? That's a big, huge cave here. It's called iliac. Why is it called iliac? Because that's where the iliac bone of the hip bone is. So they call it iliac fossa.
I thought that was the ala.
Oh, we just did this, right? Adductor? Yeah, on the humerus. Adductor. Remember, anything in the medial side is adducting. You're adducting, okay? Adducting, just, yeah.
She wants to know up, on the upside, above, and more.
Oh,
Oh gosh.
screw that.
I think it's that one.
No, it's not that one. I'm
Okay.
down too much. This one right here?
It was more up.
Oh, this
It
one right
was
here?
up. Wasn't that the Allah? The A-L-A?
Yeah. All on the other side.
Oh, okay.
Yeah.
So the Allah, that is on the.
Remember, you don't have the fossa there. Remember, that's sticking like a concave. This is convex. I'm sorry, that's the other way. This is concave, this is convex. If it looks like a hill, it's convex. If it's like a deep indentation inside, that's concave.
Thank you.
And the other side is the Allah. Okay, here, look at this bone. Remember, this is the thumb bone. What's the fancy name for thumb? Pollex. Look, I write it down. Pollex. What's fancy name for a toe, big toe?
Hallux.
Hallux. This is what? Thumb. And this is toe. Okay? Hallux and pollex. So if you see this pollex, what is that bone?
Thumb, radius.
Radius. And then the pinky is
Ulna.
ulna. Pinky, ulna. Okay? Remember, radial, ulna. Radial, ulna.
We always say to remember, like if you're drinking alcohol, rum, like as an alcohol, is your thumb, rum, thumb, radius.
I never got drunk. I don't ever drink. I don't smoke. I don't do drugs.
Well, if
Mr.
theoretically-
Kim, yeah. Mr. Kim is square, can be, and I don't relate anything to alcohol or drugs because I don't do any of it.
Okay, well theoretically,
Okay.
it works.
All right. Okay, here we go. What bone is this?
Scapular.
And how do you know this is right or left? This is this fundamental question.
The
How do you know?
knob faces. the
Remember what I
knee.
said?
This is the
You're
left.
not gonna know by looking at it this way. You're not gonna know. So you gotta flip it, and you can look for what?
The spine.
Yeah, the spinous process, right? And you know the spinous process is back. If this side is where the medial or lateral?
Medial, the knob part is.
This is lateral.
That's lateral, and the
And this is the
spine is
medial.
medial. Yeah.
Lateral, because this is where the arm is. And where's the arm at? Lateral, yeah. Bless you, Maddie.
Thank you.
Remember, your tibial is your weight-bearing bone. And the tibial sits on top of what bone in your foot? What foot bone? Talus. Then navicular, and then calcaneal. What is this? Greater tubercle. Where's the greater tubercle at anyway? You got the hip bones that look like this. And then you got this little projection. This is the hip bone. Look, that is the greater tubercle. This is the lesser tubercle. This is the neck. This is the head. Here's a funny question about the hip bone. What the heck do you call this? That little hole? Yes. Fovea capitis. Yeah. Make sure you know that. This is the fovea capitis. This is the head. This is the neck. This is the greater tubercle. This is the lesser tubercle. Then you got the linea aspera here. Linea aspera is where the butt muscle is connected. Yeah. It's like a little irregular shape that comes out like this on the side here, right here. It's called linea aspera. Linea aspera is where the butt fold, the butt muscle, gluteus maximus, gluteus minus, hooks
The,
up to.
the fovea capitis is in what bone is this?
This is what's the name of this big bone?
Femur?
Femur.
Okay, because
Be there-
that's not a femur, right?
Yeah, that's a femur.
That's a femur?
Yeah, it's supposed to be the femur.
Oh, gosh.
It's at a different
Is
angle
that
so that you
femur?
can't see
No,
that
that's not
wide
femur.
the top.
That's not the femur.
It is or it is not?
It's not.
Come on.
I thought
Oh
it
my
was
God.
Messing me up.
so that's why I was confused.
It's not the femur.
What is that?
Oh my god, that's a humerus.
That's the humerus.
Oh,
Yeah, that's the humerus.
okay. I missed the transition from humerus.
You know what? I might be wrong in this because I'm supposed to put up. Now I got a second mistake. Greater tubercle is on your femur, not your humerus.
Got it.
Yeah. Make sure you write that down. Just what Mr. Kim screwed up. Two screw up the optic canal and the greater tubercle. Two screw up. Look at your hip bone in your lab book. Look at your hip bone in your lab book. The greater lesser tubercle is on their hip bone, femur, right? Jose?
It
Nada?
says stroke cancer.
Yeah, the humerus does have one, I think.
It does have one?
Yes.
Okay, good. Then that is humerus. Then I'm
Looking at
correct then. Yes.
On the femur, it calls it the trochanter. not
Oh
the-
yeah, trochanter. That's right.
Okay.
See, you see, I'm a human. Okay, the trochanter, greater trochanter, lesser trochanter.
Got it.
God, I wish I could give you this mnemonic, but it's so vulgar.
Some lovers
uh,
try
Yeah,
positions
well, you
that
told
they
us about the
cannot
goat the
handle.
other day. I don't think that
Yeah.
could top it.
Was that? These are not my students. remember?
Yeah, that's the one.
You guys
I'm
are my
teaching for.
students,
Is it some lovers?
huh?
Is it the some lovers
Yeah, that one.
positions?
Yeah, our
Yeah, that's
teacher
how
gave
That's the
us a-
classic. I got that from doctors.
That's not very
The
vulgar.
student doctor. No.
It's
To
not
me-
that bad
Well, hey, I'm close to 60 years old. You know?
compared to what other ones we have.
Yeah, compared to some other ones.
Oh yeah, I know the other ones were worse.
Yeah.
Okay. So make sure you guys go over this, all right?
Wait. Can you go back up? Triangular? That is no. This one? That's not what we learned. We learned it was trapezium. Not triangular. I've never heard of triangular before.
Well, actually, this is the first roll. The second roll is. The second roll right here, this is called hamate. And right in front of the hamate is called the pisiform. P-I-S-I
Whoa.
form. The pisiform is right here, right, on the other side.
Oh, is this backwards?
No, you're looking at you're looking at the dorsal aspect, you're not the anterior aspect. Yeah. You're looking at the posterior aspect, not the posterior aspect.
Looking at it from a different direction.
Yeah, but it's still not triangular, or is it?
Okay, what is this little
We've
socket
been
called,
learning
guys?
I think it's just an extra.
Huh? Yeah, cerebellum. What sits in the cerebellum? Very good, very good. Now here, this is what it is. Look. Intertrochanter. You get the greater trochanter, lesser trochanter, and then you get the neck, and then you get the head. And then right that little hole here is called fovea capitis. Yeah. Oh my God! What? You don't have to know that one. There's not gonna be any. What is this hole called? Right here, between
Foramen.
the ischium and ischiotuberosity. What is this hole called? Obturator. Obturator foramen.
Between the ischium and ischium tuberosity
Yeah.
is the obturer.
The ischium is the sitting bone. Your bone that you sit. You sit on the bone that you actually sit on is called the ischium, and we'll go over that. Oh, what is this called? You got the greater sciatic notch and lesser sciatic notch. You got the notch, and then right across it, this is the anterior structure of the iliac spine. You guys get it? You got the greater, lesser, then right across it is the iliac spine, inferior iliac spine. Superior. Here's the collarbones that Maddie was asking about. So this is very, very interesting. You remember I told you about the rib cage having that tubercle that sticks onto what? Guys, you remember the tubercle on the rib cage right here? This side connects to what side? The thoracic side, right? This side has the tubercle. What does the tubercle connect to? The tubercle.
The ribs?
No, the collarbone sits the shoulder blade and your manubrium. Remember, you got three parts of the sternum bone. You got manubrium, body, and xiphoid, right? So right at the manubrium, that's where that sits. So that tubercle sits on the what side? What bone? The shoulder bone, the scapular bone. Remember, this part, you're looking at the back half. Because if you go to your bone here like this, it's kind of sticking out, right? That collarbone is actually sticking out like this. It's out like this. If you show your collarbone, you can see it's protruding out. That part that sticks out is this front part, right here. You see how it sticks out here like this, and then it curves back here. So that curve is what hits the shoulder bone. And that's where the tubercle is. Yeah, so the front is right here. And this is the back half, what you're looking at. The posterior aspect of it. The anterior will be the inside.
So that's the right one.
Yeah, yeah.
Okay.
So everybody got this? Now you can tell left and right from, right? Yeah. So this is a coinoid, a tubercle. Coinoid tubercle. And I can't recall, but you have no meniscus there. And if it's a lateral meniscus, this must be the medial meniscus. You remember the lateral meniscus looked like this guy. Lateral meniscus looked like this. Like this, guys, right here. When you're looking at lateral meniscus, it looks like this. And your medial meniscus looks like this. Like that. Your lateral meniscus is almost a complete circle, and it's bigger, because this is where, if you look at the weight bearing and the compression and tension of your femur, you'll understand why the lateral is bigger versus the medial. The medial is those the one that look like horseshoe, but the lateral one looks bigger, and it's almost a complete circle. Okay, that's the only difference. And then you got to know these collateral. The lateral collateral. Remember, this is what? This is the fibular. This is the what?
Tibia.
Tibial. So this will be the tibial collateral, and this is the fibular collateral. Collateral is the ligament on the very outside. So you got the tibial collateral, and you get the fibular collateral, and then you get the meniscus. That must be the what? The medial meniscus. That's the lateral meniscus. Because this what? It's on the tibial side. Tibial side is the medial side.
So you say the ligament on the very outside
It's called collateral.
of the knee?
Yeah.
Outside of the knee
Yeah, yeah.
would be, okay,
It's called the collateral ligament.
okay.
So if it's on the tibial side, there's always talking about the medial. And then the outer collateral ligament is called the tibial collateral. And then on the outside, lateral side, it's going to be the fibula, and it's going to be the fibula collateral ligament. It's confusing because you're locating the bone.
The tibia is medial or lateral?
Tibia is always medial.
Medial?
Yeah.
Okay.
That's why that's called the, look over here, look. That's why that meniscus is called medial, and this is called a lateral meniscus.
Lateral for the
Meniscus,
fibula?
yeah, yeah.
Okay.
It's kind of confusing at first, but once you get used to it, you'll see why. So you got the medial meniscus, lateral meniscus. This ligament here is called fibula because you're sitting on the fibula. And then here you get the tibial collateral meniscus. Everybody take a break.
Yes.
Take a break. Everybody take a break.